You know, with all the recent coronavirus scare, something that a lot of us tend to overlook is, does my insurance plan actually cover the coronavirus? Well, I'll go over that and some tips at the very end of the video to find out if your plan covers that, coming right up. Alright, so my name is Matt Ragudo. I'm a chartered retirement planning counselor and have my certification for long-term care planning. And a lot of my clients have questions a lot of times about their medical insurance. And I do help a lot of my clients choose a Medicare plan or a health plan that can be found on the healthcare exchange. And yesterday, March 10th, 2020, finally the US has decided as a whole to include coronavirus testing and treatment as one of the 10 essential benefits or 10 mandatory benefits of the Affordable Care Act plans. And these are the plans you can purchase on the healthcare.gov, otherwise known as the healthcare marketplace or the healthcare exchange. Now, one thing to be kind of aware of is that each different insurance company, in the article I referenced, they talk about United Healthcare, Aetna, all those different companies have different plans, and each within those different plans there's different co-pays and co-insurances. So while they do say that it is covered, make sure to check your plan documents to find out if you have a deductible, if you have any kind of co-pays, because while it is a covered benefit, it's still not covered as in the financial sense where it's free. Now, for those of you folks who are part of the Medicare line, Medicare began covering the coronavirus back in February, and I'll link to the CMS or the Center for Medicare and Medicaid Services announcement there. And when I say Medicare, I mean both Medicare and Medicaid cover testings and treatment for the coronavirus. While they recently came out with some new guidance as far as what qualifies as the coronavirus testing and as far as like when or if the doctor can send it in. Those guidelines did come out, and while with anything, it does have to be what Medicare and Medicaid consider medically necessary for it to be a covered service. And as far as my research last night and this morning, pretty much all the insurance companies are saying that it has to follow suit with the CDC guidelines for testing. And unfortunately, the CDC guidelines for testing have changed a multitude of times over the past few weeks. So I would highly encourage you, if you do feel like you have or you are at risk, call your physician, call the CDC, find out if you should be tested. And most of the doctors, and I'll link a good video that one of the doctors who posts a lot on YouTube talks about the coronavirus. I'll link up to his video either up in the card here or in the description below, as well as all the links that I'm referencing to in the description below. But the main thing is that yes, insurance does cover the coronavirus, but the insurance might charge you your deductible, co-insurance, whatever that is, and no one right now knows how much the test costs because no one releases that kind of information. And number two, you should really stay home. If you think you have the coronavirus, call the CDC, call the physician, call the urgent care. Let them know what your symptoms are, and then they can send someone to your home, like an EMT office or ambulance or public health care professional that can go out to your home, do the assessment there, and then figure out a treatment plan. Because my last point, I don't know what number we're on, but the last point I want to make is that there's no quote unquote cure. It's a viral infection. So I'm not a physician, I can't give you physician advice, but I can tell you that most viruses like the flu, you kind of just have to wait out. You don't want to get any more sick. So you'll see in the video, if you watch the video of the physician, he says that he highly encourages people to stay home even if you just have a regular illness, because the kinds of things you can pick up when you go to the doctor's office could be far worse than the actual virus you have yourself. So it's treatment, it's symptom-based treatment. So if you have runny nose, fever, you're going to be taking some kind of, fever reduction medication, cough reduction, some kind of antihistamine, decongestant, those types of prescription. They can't just give you an antibiotic because it's a viral infection, not a bacterial infection. Well, anyway, I hope this helps for all of the members out there who are members of the plans that I represent. Humana, United, all those people have links in the YouTube description, but they all cover it. And you're looking at a lab copay, and any kind of treatment beyond that just is a covered benefit under your plan. So check your plan pricing to find out how much you have to pay if you have to be admitted, if you have to go to the ER, or if you have to go and see the urgent care of the physician. One extra thing, tips part of this video is for those of you folks that have access to telemedicine, meaning you can call up a 24-hour line where you have access to either a physician assistant, APRN, or an MD, you can actually get all those services for free. And the good thing about those folks on the phone is they're actually trained to take calls like this, symptom-based calls, and do a thorough assessment over the phone. Many times our physicians that are standard brick and mortar, they actually are much more comfortable with you folks coming in. They don't feel comfortable with doing a symptoms-based phone encounter, which these telemedicine companies are of course trained to do. So if you have access to telemedicine, and a lot of the plans out there do, I'll link to the some of the plan telemedicine companies that I know of, and you can go ahead and give them a call as far as your plan. And if you receive this as an email, you'll receive the actual telemedicine number if it is available for you. And the last thing you can do to kind of help ease that deductible is go ahead and take a look at the video that talks about what's called a health matching account, or an HSA. Those are two different things, by the way, but those are systems set up for those of you who have high deductible or reasonably costly deductible plans, so that you can actually afford care when you need care, but it allows you to save money every month versus having to pay premiums every month for your medical costs. So go ahead and check those out. I will be back next week with another tip about medical insurance, health insurance planning. But for today, that was our video on the coronavirus. Bye-bye now.